The 2014 General Session of the Utah Legislature is over, but the debate over whether to expand Medicaid eligibility continues. Watch this video to learn how 5 proposals debated during the last session compare with one another, what's underway now, and what may be on the horizon. The actions of the legislature this year were a response to the Federal Patient Protection and Affordable Care Act, which, as it passed in 2010, was designed to expand enrollment in health insurance to a large number of Americans unable to afford coverage. To accomplish this, the Affordable Care Act created an online health insurance marketplace where policies can be purchased with federal subsidies to make them more affordable. Subsidies are limited to people who have incomes between 100% and 400% of the federal poverty level and don't otherwise have access to affordable coverage. To expand enrollment, the Affordable Care Act also required states to expand their Medicaid programs to cover more people, primarily adults, in households with incomes up to 138% of the federal poverty level. Most of this mandatory expansion, however, was ruled unconstitutional and therefore optional by the U.S. Supreme Court. As a result, adults who have not traditionally qualified for Medicaid, those who do not have a child living in the home, are not disabled, and are not pregnant, fall into 2 groups. Those with incomes above 100% of the federal poverty level are now eligible for federal subsidies in the new marketplace because they are ineligible for Medicaid. But those who fall below 100% of the federal poverty level are eligible for neither subsidies nor Medicaid. They fall within what has been called the donut hole, the gap where government-funded assistance is unavailable unless their respective states expand Medicaid eligibility or Congress lowers the income threshold for subsidies below 100% of the federal poverty level. The debate then during the 2014 session was over whether to expand Medicaid eligibility, whether to expand it to 100% of the federal poverty level to cover only the 70,000 Utah adults in the donut hole, whether to expand it further to 138% of the federal poverty level as originally envisioned by the Affordable Care Act, and whether, if Medicaid eligibility is not expanded, to provide some other means of assistance to those in the donut hole. Each of the 5 proposals considered during the session addresses the donut hole population, and several change coverage options for other individuals as well. The first of the proposals, House Bill 401, was introduced by Representative Jim Dunnigan. House Bill 401 creates Access Utah, a program to help those with household incomes under 100% of the federal poverty level, or about $24,000 for a family of 4, to purchase employer-sponsored health insurance. It does so by augmenting the individual's and the employer's premium contributions with premium assistance to make the coverage more affordable. For those without an offer of employer coverage, House Bill 401 provides premium assistance for the purchase of non-employer coverage, either in the commercial insurance market or in a system of care to be established by the Utah Department of Health, a system that coordinates the delivery of physical and behavioral health services. As already mentioned, people between 100% and 400% of the federal poverty level are eligible, as of January 1st, for federal subsidies in the new online health insurance marketplace established by the Affordable Care Act. These subsidies, combined with an individual's own resources, are available to those without affordable employer coverage to purchase coverage in the marketplace. Enrollment in Access Utah could reach 64,000 by 2021, but is dependent on how much the legislature appropriates to the program each year. Although House Bill 401 did not include a specific appropriation, it was suggested that for the first 2 years, the pilot phase of the program, $35 million a year in state funds might be appropriate. House Bill 401 does not rely on the enhanced Medicaid funding available to states under the Affordable Care Act. That funding covers 100% of Medicaid expansion costs through 2016, decreasing to 90% by 2020. Instead, House Bill 401 is crafted to take advantage of the favorable Medicaid funding arrangement already available to Utah's Premium Partnership for Health Insurance and Primary Care Network. This arrangement, however, would require a waiver of certain federal Medicaid regulations. If the waiver is not granted, Access Utah is designed to operate on state revenue alone. The second proposal considered by the legislature, Senate Bill 251, was introduced by Senator Brian Shiozawa. Senate Bill 251 also uses premium assistance to target individuals in the donut hole, adults with incomes up to 100% of the federal poverty level who are not otherwise eligible for Medicaid. Like House Bill 401, the assistance can be used to help purchase non-employer coverage when employer-sponsored coverage is not available. In contrast to House Bill 401, Senate Bill 251 relies on the enhanced Medicaid funding available under the Affordable Care Act and requires a federal waiver of certain Medicaid requirements. Senate Bill 251 also places emphasis on personal responsibility and guarantees that coverage meets Affordable Care Act standards. As with House Bill 401, individuals over 100% of the federal poverty level are eligible for federal subsidies in the health insurance marketplace. Enrollment under Senate Bill 251 could reach 70,000 by 2021 at an estimated cost that year of $25 million in state funds and $275 million in federal funds. The third proposal, Senate Bill 272, was introduced by Senator Gene Davis and is similar to legislation introduced in 2013 by Representative Rebecca Chavez-Houck. Unlike the other two proposals, which expand coverage to adults up to 100% of the federal poverty level, Senate Bill 272 expands Medicaid to 138% of the federal poverty level, as originally envisioned by the Affordable Care Act. And, also unlike the other two proposals, Senate Bill 272 relies on Medicaid's traditional system of contracted doctors and hospitals rather than providers available under employer-sponsored plans. In other words, it does not provide premium assistance to enroll individuals in commercial insurance plans. Further, Senate Bill 272 does not seek or require a waiver of certain Medicaid regulations in order to be implemented. Enrollment under Senate Bill 272 could reach 160,000 by 2021 at an estimated cost that year of $60 million in state funds and $640 million in federal funds. The fourth proposal considered by the legislature was made by Governor Gary R. Herbert. Like Senate Bill 272, Governor Herbert's Healthy Utah plan targets individuals with incomes up to 138% of the federal poverty level. But unlike Senate Bill 272, it does so using a premium assistance model, just like House Bill 401 and Senate Bill 251. And, like Senate Bill 251 and Senate Bill 272, the Healthy Utah plan relies on the Affordable Care Act's enhanced Medicaid funding formula. And again, like Senate Bill 251, the governor's proposal requires a waiver of certain federal Medicaid regulations in order to be implemented and places an emphasis on personal responsibility. Like Senate Bill 272, enrollment under the governor's proposal is expected to reach 160,000 by 2021. At this point, however, an estimate of the state and federal costs has not been made. Although the Healthy Utah plan was never introduced as legislation, it was considered carefully by legislators in both the House and the Senate. Senate Bill 251 was even amended by the Senate so that in the event it did not receive approval from the U.S. Department of Health and Human Services, the governor and the Utah Department of Health would be explicitly authorized to engage in further negotiations with the U.S. Department of Health and Human Services, which could include consideration of the governor's Healthy Utah plan. In the end, none of these proposals was adopted. Not House Bill 401, not Senate Bill 251, not Senate Bill 272, and not the governor's proposal. In fact, the House proposal did not pass the House, and neither of the Senate proposals passed the Senate. What did pass both houses, though, was a substitute version of House Bill 401 with the Access Utah program removed and a study requirement substituted in its place. That requirement directs the legislature's Health Reform Task Force to coordinate, evaluate, and make recommendations on Medicaid expansion proposals, including those made during the 2014 general session. During the session, both houses of the legislature understood that if no legislation passed authorizing a particular coverage expansion, the governor would still be free to seek approval from the federal government for his Healthy Utah plan or some other version of expansion. They also knew that if the governor obtains federal approval, he will still be required to obtain their approval during either a general or a special session of the legislature. At this point, the governor hopes to obtain federal approval of his plan by the end of summer and to call the legislature into special session sometime afterward. The legislature considered one other proposal that affected those in the donut hole. Senate Bill 75, Primary Care Grants Amendments by Senator Alan Christensen, makes a one-time appropriation of $2 million for fiscal year 2015 to be used for primary care grants. These grants will strengthen the existing network of public and nonprofit agencies in the state providing health care services to the uninsured and medically underserved on a no-cost or low-cost basis. As a result, basic health care, including primary care, dental care, and mental health services, will be available to as many as 40,000 additional individuals. Senate Bill 75 passed both houses of the legislature and was signed by the governor. In summary, then, the legislature adjourned earlier this year without expanding Medicaid eligibility to 138% of the federal poverty level as originally envisioned by the Affordable Care Act. Nor did it expand eligibility to only 100% of the federal poverty level. Nor did it create an assistance program potentially funded with only state revenue. It did, however, fund a significant one-time increase in services available through public and nonprofit health centers, services that will be accessible by those in the donut hole. And it did leave the door open for further negotiations between the governor and the federal government. Those negotiations could lead to federal approval by the end of summer and a special session afterward. For additional information on this and other policy topics, please visit the Utah Legislature's website at www.le.utah.gov.